Welcome to rePROs Fight Back, a podcast on all things related to sexual and reproductive health rights and justice. Hi rePROs, how's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, I'm back from my vacation in Wisconsin. I had a great time. It was so nice to see family and spend time with my mom. Yeah, it was a lot of fun. I was able to meet with some aunts and cousins and planned a trip with an aunt and some cousins. And yeah, it was a lot of fun. It was just nice to, honestly, I just stepped away from everything. I didn't check my email at all. I spent some time outside. I may have gotten attacked by some bugs and my legs had these huge and terribly itchy bug bites on them, but it was still delightful and nice to just get away from everything. I was able to do some reading and just have some quiet time and get to see my mom, which was always nice. And we didn't do anything super exciting, ran some errands, went out to dinner with one of my aunts and one of my cousins. Unfortunately, my other cousin that I usually try and see when I'm home was unable to make it. But since I know he listens, John, we missed you. See you when I'm home at Christmas. Yeah, but it was nice. It was just really nice to be away from all the things. And then I came back and was, plunged back into all of the things that were waiting for me, being gone for a week. But I'm now all caught up, I think. I've got through all my emails and did all the things. There was a big podcast conference in DC, but I decided not to go this year because it was back to back with my trip to Wisconsin, and I would have had to stay at the hotel outside of town. And my poor kitties were already so upset with me being gone for a week that they were attached to me. So I thought being gone another 4 days to go to that conference was probably not the best choice. And, I didn't need to go. But I did make sure to run out one day and see the wonderful Elsie Escobar, who's been a wonderful mentor and coach through my work in podcasting. And so I had some things I wanted to talk to her about. And so it was really lovely to go and have a chat with her and get to see her in person for the first time in a while. So yeah, it was very lovely. So I'm now ready to dive back into the fray and all the things that are have been waiting for me to get caught up on. But yeah, so I'm ready to dig in and get going and feeling a little refreshed, which is exciting. And I'm really excited to share this week's episode. It was a lot of fun. I had a great conversation with Rebecca Zerzan with the United Nations Population Fund, talking all about the progress we have seen over the last 30 years around sexual reproductive health and rights, and where there are gaps still and how the progress is slowing down, and talking about the inequities we are seeing around sexual and reproductive health and rights. It was a wonderful conversation, and I hope you all enjoy it. So let's go to my interview with Rebecca. Hi, Rebecca. Thank you so much for being here.
Hi, it's great to be here.
I'm so excited to talk to you today. Would you like to introduce yourself before we get started and include your pronouns?
Excellent. So my name is Rebecca Zerzan, and I'm an editor at UNFPA, the UN Sexual and Reproductive Health Agency, and my pronouns are she, her.
So I think that's a really great place to start. I do a lot of work with UNFPA and the other side of my job, but I think a lot of people, particularly in the US, maybe aren't as familiar with UNFPA. So it feels maybe a good time to take a minute and talk a little bit about the work that UNFPA does.
Awesome. Yeah. So UNFPA, our letters are a little bit, long and confusing. It's because we're technically the UN Population Fund. And we were created, in the 1960s, a super long time ago when everyone was really concerned about population. But we describe ourselves now as the UN Sexual and Reproductive Health Agency because even from the very beginning, the majority of our work has really focused on making sure that people have access to sexual and reproductive health services, particularly family planning, and also that we are teaching people about their sexual and reproductive, their bodies and their rights. And so that's the basis of a lot of the work that we do. We're, I think, the world's largest procurer of donated contraceptives, which we distribute mostly in low and middle income countries. And it's not just a matter of, handing out contraception to people and saying, plan, it's also really kind of like the A to Z of everything that people need to be able to exercise their reproductive rights. So that includes, working with organizations and communities and governments to make sure that teachers are equipped with, medically accurate, culturally sensitive education materials so that people can learn about their bodies. And a really important part of that is about their rights. So we're, really involved in measuring, for example, the percentage of women in the world who are able to say no to sex. Those numbers, unfortunately, are really not great. We also work with midwives to ensure that women who are pregnant are able to access antenatal care, that they're able to give birth in a safe environment with the care of a trained professional and receive all of the postpartum care that they need. So it's all of those elements from health to education that involve human reproduction that we really work in.
I do, like I said, I do a lot of work with UNFPA, and they do such amazing work, y'all. I think where my audience may be a little more familiar in that we've talked about it before on the podcast is UNFPA really plays an important role around sexual and reproductive health, particularly in humanitarian settings. We've had a couple episodes talking about that work, but yeah, they do amazing work in a lot of other contexts as well.
Excellent. Yes, I really appreciated those episodes, by the way.
Yeah, I was so grateful that y'all were able to help with the Gaza one, because I know that your people were so busy and trying to do so much that I was really grateful that they were able to take some time to record something for it.
I mean, just as a total aside, the work that we do in humanitarian settings really illustrates how sexual and reproductive health and rights are so much broader than people think. People think, oh, it's, got to go to the gynecologist and get my pap smear, got to get access to condoms or whatever. But when you look at a humanitarian crisis, you really realize that, if you don't have access to your contraception, if you don't have your doctor or your prescription, how are you going to protect yourself and your family from an unintended pregnancy? The issue of sexual violence spikes in a humanitarian context. And then there's this whole area of work that is totally necessary and part of sexual reproductive health that people don't think about, which is, trauma support for experiencing gender-based violence, for experiencing rape. All of these things really fall under the umbrella of sexual and reproductive health and rights.
Yeah. It's one of those things that we have really been trying to uplift because it is such an important thing that it is coming higher on the agenda, but so often in a humanitarian crisis, the first thing that people think of is food, water, and shelter. But people don't stop being pregnant. People don't stop wanting to not be pregnant. Sexual assault goes up. It is so important to have those resources in place from the start to ensure that people can access them.
Absolutely.
Okay, but we're not here to talk about all that. We're here to talk about the report that you worked on. So I think a really great place to start is the progress that's been made. Can you tell us about some of the progress that I really love that the report starts focusing on how far we've come? And I think that's important to do because it's so easy to get caught up in what needs to be done that you can forget that so much has been done.
Totally. So we released a report pretty recently that really tried to look at the last 3 decades, what has happened in the world over the last 3 decades. And it's easy to forget that 3 decades ago, the world was just a completely different place. As a person who remembers 3 decades ago very clearly, it's almost shocking to see how different the world was and how far we've come, and in the best possible way. So 3 decades ago, we saw that we were really just grappling with what is the scale of maternal death. We didn't even have really great statistics. And now not only do we have really firm numbers, but we also see that the rates of maternal death, meaning, dying from complications of pregnancy or childbirth or the immediate aftermath of childbirth, that those have fallen a huge amount, 34% in the last 3 decades. We've also seen that the number of women who are able to use contraception has doubled. Adolescent births have fallen by a third. We see more than 100 countries, I think it's 160 plus countries, have passed legislation against domestic violence. I mean, just really, really great progress that we're seeing in the world. And it's easy to lose sight of when you look at the headlines, but it's really something for us to celebrate.
Yeah, I I think about that even just like in my own work. Like I have been doing this for a little over 16 years now. And so it's easy to think of like right now talking about the maternal mortality crisis and how bad it is and things need to change. And while that is still true, full stop, still true. When I first started, I remember we were talking about a woman dying from pregnancy-related causes every minute. And like, that's not the case anymore. So like huge progress has been made, but there is still so far to go. So maybe we turn to that. Like progress does seem to be slowing a bit. Like I'm sure it's very complicated and there are lots of reasons, but do you want to talk a little bit about why?
Yeah, absolutely. That's one of the big questions that the report is seeking to answer, because we are seeing across a lot of different measures that progress is slowing. And by some measures, really tragically, progress is stopping or even reversing. And I'm going to keep talking about maternal mortality just because that's one of like the really clear areas where there's really urgent need and where we have really good global data. But this applies to all areas of sexual and reproductive health and rights, And so if we look just at the maternal mortality data, where, we have more than 30 years of commitments to dramatically lower maternal death rates. And yet now when we have all this technology, when we live in this global society, when we've got telemedicine and we've got, incredible training available globally, we're still seeing that maternal death rates, the year-on-year improvement has reached zero. We are not improving in terms of reducing maternal death. And our data only really goes to the first year of the pandemic, which we know had a negative impact on, that COVID itself increased maternal mortality. We know that all of the systems, shuttering and everybody having to sort of like pivot their, where their health resourcing was going, that also had a negative impact on maternal survival. So we have every reason in the world to think that those rates might be going up. And we actually see in a lot of really rich countries, really tragically, that the trajectory from like 1990 to now is actually worse. So there's a lot that we need to be doing.
Yeah, I think one of the ways that some of this was really illustrated to me in the last year was seeing luckily they changed their mind, but the Gambia talking about rolling back their FGM protections, and like that was scary to think that we had gained so much ground on banning that practice that we might start to see this trend of like countries rolling back their commitments.
Yeah, that was really horrifying. And I have to say, I'm just so admiring of the work that people on the ground in Gambia did, particularly community members and activists. And I think that that's a really interesting kind of entry point into the question of why is progress stalling? And of course, there's a million factors.
Yeah.
There's issues like the pandemic, there's the debt crisis. I mean, there's a million reasons, but one really core reason is that we have just globally as a society not really looked into how our systems really emerge from periods of really terrible inequality and continue to perpetuate a lot of those assumptions, a lot of those resource gaps, the acquisition of knowledge and things. They're really based on biased information, and they perpetuate bias in ways that are really unfortunate. And then when we try to correct that, when we try to bring in more inclusive voices, the voices of women and girls on the issue of female genital mutilation, as one example, we very often experience a backlash of often people who are in power or people who have experienced a lot of the benefits of society, which have, again, been tremendous. But a lot of people will say, oh, well, we shouldn't be privileging those voices, for example, or our culture or what our perspectives. And the process of seeking greater inclusion in these areas can be seen as a threat. And I think that's really unfortunate.
Yeah, it's always so much more complicated. And the pandemic definitely didn't help. We know that like gender-based violence and child marriage went up. And so again, like the thought of there being like, there's never like the one easy silver bullet answer, right? Like that if we just fix this one thing, everything will be so much better. But I think one of the things the report talked about was misinformation. And I know that's something we talk about a lot, like in the domestic context of misinformation and disinformation in the US, but we also see it a lot globally, and it affects people's ability to access care.
Absolutely. And, misinformation is really, it sounds like it's specifically like disinformation that is baked into information. But it's also inclusive of just the omission of information. And we see that from bottom to top, the way that, and we see it baked into medical education even, right? With outcomes that are deeply and extremely unequal. So for example, a lot of medical textbooks still use a classification of pelvic shapes that considers the pelvic shapes that are more common to white women as being more standard, and other pelvic shapes are considered less standard. And researchers say there's potentially extremely dangerous consequences to that, of thinking of people of color as being non-standard. We see it in how medical students report perceiving the experience of pain among people of color. And that's not, just in any one part of the world. These biases are global. We see them as well in how people talk about human development. Right? And we see it in classrooms. So, for example, in a lot of places, people still think of menstruation as a sign that, you've become a woman, your body can become pregnant, you are, in some places, marriageable. And that idea, it's such a simple idea. And if we just altered it slightly to say that menstruation is one part of a long process of development, which makes a person able to have a baby, it's such a subtle distinction, but it makes clear, things like, girl shouldn't be robbed of her girlhood just because she started to menstruate. And those misperceptions can have huge consequences when they're held by doctors, by community leaders, by policymakers.
Yeah, all of this together, and also thinking back to what you talked about, what UNFPA does is, making sure that people are able to access sexual and reproductive health services. But this all plays together, right? If you aren't given the information to know that these are your options, you are not able to access the service because you don't know it exists. If the provider doesn't understand that young people should have the ability, or unmarried people should have the ability to access birth control or other sexual and reproductive health services, they will prevent young people from accessing that care. So this is all part of one story that using the word access, it has so many layers to it, right? If you are in a child marriage, your spouse may be preventing you from accessing services. So access covers so many things that seem so simple when you just say somebody's unable to access birth control.
Absolutely. Absolutely. And I think that there's a really common misconception that the biggest barrier to using contraception is, that a person can't go to the corner store. Maybe there's no corner store, or that, the biggest barrier is that your husband has, blockaded the doors or something. And in fact, the social and cultural norms are some of the biggest barriers, opposition to the use of contraception, concerns about side effects because you don't have a wide variety of options. All of those are huge, huge, huge barriers that really just go to the issue of having the right information.
Yeah. And again, misinformation, right? So the misinformation isn't just the ability to know that you can access the services. Sometimes it's hearing that, birth control is going to cause infertility or whatever the misinformation that may be in your community that may be blocking you from accessing that care.
Absolutely. The stigma that using contraception means that you'll be unfaithful. The stigma that if you have access to contraception, suddenly you'll become promiscuous. All of these things serve as enormous barriers. And, those are falsehoods, right? Those are demonstrable falsehoods that we can and should be talking about.
So are there other parts that you want to raise up around what else is slowing the ability to get progress?
Sure. Well, if I could first just mention one other, form of misinformation that I think is really pernicious
please.
And is really widespread. It's the idea of, forgive the term, but gender essentialism. Right. And we see that being, taught in schools. We see it being taught in communities, and we see it just kind of, in the broader atmosphere of how people talk about, relationships and sex and gender. And gender essentialism is basically the idea that there's just these fixed categories of men and women, and they are fully distinct in their biology and in their innate capacities. And yeah, we could make sort of general statements like, women and girls have XX chromosomes, men and boys have XY chromosomes. But even that framing, which captures, 98% of people potentially, it ignores a huge number of people who have variable traits, have variable hormone levels, have variable characteristics, and we're not really learning that that is just a part of the normal spectrum of human experience, right?
And we just saw that, right? We just saw it with the Olympics.
Absolutely. Totally. 100%. 100%. And we look at, we don't think about teaching things in that way as being exclusive, but it is a form of exclusion. And that form of exclusion, that form of kind of binary thinking, enables really abusive behavior, as we see. And so I think, and when we see that in medical settings where people who are, fully a man or fully a woman and have, one variable trait or experience can be treated terribly in a medical setting or by their community or even potentially killed, And so if we could just recognize that, that there's a diversity of expressions of how bodies exist in the world, I think that would be so much better.
Yeah, and this is another one of those where it felt like there was being real progress made on it, and all of a sudden the anti-rights agenda has really become so much louder and is really spreading, and I'm really worried about not just like progressing, I'm really worried about seeing regression, and I think we are already seeing it in some places.
Absolutely. And that's one of those forms of progress being reversed because these things are being politicized and they just truly don't need to be politicized. One of the key kind of recommendations of the report that has me the most excited is really thinking anew about ways that we can be more inclusive in all of our decision making in, whether it's how health systems are structured and designed, or whether it's, how we're teaching about human bodies and sexuality in classrooms. I just think that, calling for people to make a proactive effort to listen to communities that have traditionally been excluded from the conversation could make everything so much richer, and also doesn't contribute to polarization. There's this false notion that including more voices means diminishing my share of the space. And history shows us that inclusion benefits everyone. We've got really amazing examples of that. The simplest example, and I think, but I think that is kind of the most telling is, in the 1970s, all of these disability activists went out at night and crushed the corners of sidewalks in order to install their own curb cuts because the cities weren't doing that. And the result of having curb cuts is people realized, it's not just for people with mobility impairments. It actually helps if you're a human being who's ever pushed a stroller or pulled a wagon or a shopping cart. Everyone benefits, rides a skateboard, right? And that is true of increasing the inclusivity of our sexual and reproductive health systems. We found, for example, one of the key findings of our report is that inequality, when we look at women and how they answer the question, has your access to healthcare improved? We look at those answers across surveys where we have ethnicity data. So it's not that many countries that even have this data, but in the countries where we do have that data, we see that inequality, obviously there's been progress, right? Women have better access to health services. They're better able to get, this is self-reported. I can go out and I can seek care. But the pace of improvement is so much greater among women who are affluent and belong to a more privileged ethnic group. And those disparities are growing over time in many, many countries. And what we see is very often inequalities are greater within countries than between countries, which is something that a lot of people don't want to hear. They don't want to hear that the societies are becoming more unequal. And yet what we find from some of the good examples, Ghana, for example, is one of the countries where we found that ethnic disparities in health access among women were sharply declining. And so we called up our colleagues in Ghana and said, look, we found this, incredible story that is so different from what we're seeing in so many parts of the world. What do you think accounts for it? And they said, well, probably because, we implemented not UNFPA, but Ghana implemented a policy of free maternal health care and national health insurance. And that's not something that is directed specifically to, exclusively helping ethnic minorities who are poor. That's something that's for everyone. Everyone benefits, and we reduce inequality. Same for gender-affirming care, for example. Researchers say that the things that they have learned from providing, hormone therapy and gender-affirming care could greatly advance how we treat menopause symptoms. So the act of inclusion, it doesn't hurt people. It helps everyone.
Yeah, I just, making sure that services are getting to those the most marginalized means that if we know that they are having access, then we know everybody does.
Yeah, absolutely. And there's a real fear that I have about how efforts to be more inclusive is really kind of being contorted into, something like a wedge to divide us.
Yeah, like we're favoring or...
Absolutely. And in the case that you just described with the Olympic boxers who are being falsely claimed to be, to have gender diverse characteristics or sex traits that it's just not true, first of all. But maybe if we stop trying to police women's bodies, all women would benefit. Maybe if we recognize that, it is most often women of color who are perceived as failing to meet certain feminine standards and stop trying to apply those standards, then people of color would benefit. I mean, people on all parts of the spectrum of humanity would benefit.
Yeah, I mean, as trans people have been saying, it's not only us who is going to be harmed by these anti-trans policies, particularly around women in sports, but even just around any number of things. It's also going to be cis women and cis women of color who are going to feel the impacts of these restrictions.
Absolutely. And we talk in the report about Caster Semenya, who very similarly, an incredible woman runner who is just being attacked and being prevented from participating in her sport. And, if we could just reflect what's not only just have a more open mind about accepting people, but also if we just reflect the biological reality that there is diversity in the world, I think everything would be a lot better. And we could figure out how to reform our systems in a way that better met everyone's needs.
And I think it's also important to note, this was a conversation around, a couple of specific Olympic athletes, but it was then taken over and by people who have very large platforms. And it was seen by young trans people who may be wanting to think about getting into sports. And this may be something that prevents them from even wanting to do that. And that is just crushing.
I mean, it's just really sad when you see all of the various ways that a misunderstanding about, the human body and human sexuality and a lot of norms that are based in assumptions can really derail people's lives and make it very hard for them to thrive. A lot of our medical systems are, based on historical inequalities, and people don't want to see all of the various ways in which those historical inequalities are continuing to yield unequal outcomes because they see it as an attack, right? Oh, you're bringing up the past. But it doesn't have to be about blame. It doesn't have to be about this happened 200 years ago, therefore we're mad at you. It's just saying, look at the outcomes that we are still having. And let's use those outcomes as an opportunity to reevaluate which parts of our system are not serving people.
This all makes me think of one of my favorite hobby horses of the important role and need for comprehensive sexuality education and making sure that everybody is getting an inclusive sex education. And I always go back and talk about, I did not have that. I went to Catholic school, K through 8. I had sex ed from a nun. There are so many things that I could have learned and didn't learn. And there are so many people who are getting similar or worse than I got. And it's just really important. We could cover some of that gender inclusion and all of those things and so many things that can be covered in that. And you get rid of that stigma and fear and the unfamiliarness, which I think so many people are grappling with right now.
Totally. And I think there's just kind of a real disconnect when people even think about sex ed. So, for example, we say, comprehensive sexuality education, and that just is to distinguish this education that is provided to international standards from what somebody might just give based on, whatever's happening in their textbook or whatever. And there's also a misunderstanding that sexuality education provided to international standards means that we are bringing in, these foreign ideas that are being imposed on our communities. And that is just completely false. Again, fake news. It's misinformation. Sex education provided to international standards involves and requires the participation of communities. It is not imposed externally onto communities. It's not saying, hey, you need to change your pronouns, hey, young people need to have sex. I mean, no, of course not. It means culturally responsive curricula that are developed with community members, meaning parents and young people themselves, to reflect their needs. Right? It makes no sense to take a sex ed class that's being given in Poland and impose it on a community in Burkina Faso, or the other way around, right? Totally different needs. There's parts of the world where girls have to grapple with the fact that they are, facing predation from sugar daddies who are offering to pay for their school fees in exchange for sex. Girls in those communities need to learn about their rights, need to learn that that's a form of exploitation. Boys in those communities need to learn that that is not acceptable. Parents in those communities need to learn that they should not be victim blaming girls who fall prey to these kinds of schemes. That is a different lesson that needs to be taught in a community where, there's high rates of a very specific kind of STD, right? Like there's lessons that need to be localized and determined by the community according to the community's values. And they also need to be medically accurate. And those two things don't have to be in conflict. And yet, people think, I don't want my kids to be taught by some, foreign cabal of, Western educators or whatever. And it's like, that's just not what that is.
Ugh. I don't want to cut this conversation short, but man, I think we've already covered a lot of this, but just in case there's anything we missed, what else can we do to fix this?
Well, something in our report that I think, obviously, the issues of the inequalities that exist, I think that that's hopefully ringing loud and clear to people, that there's so much work that we have to do. Our report finds that 1 in 4 women in the countries where we have data cannot make decisions about their own healthcare. 1 in 4 can't say no to sex with their husband or partner. I mean, those things they should be shocking, and yet they're not, because it's the case for so many people. I think that hopefully those are messages that are ringing loud and clear. Something that I think has maybe been overlooked is how a history and a legacy of racism and sexism and colonialism has really continued to infiltrate our health systems. It's really unfortunate, but the reality of, modern sexual and reproductive health care, and this is often used to attack those of us who are working in this space, but we're the first to recognize, that the history of that healthcare emerges from women midwives being shunted aside by an emerging medical establishment that was male-dominated. And their knowledge of contraception and childbirth was called, arcane and harmful and primitive. And male, quote-unquote, scientific doctors really kind of took over that space, and not just in Western countries, but everywhere. And we also see, a legacy of women being experimented on, enslaved women, women in colonized societies, indigenous women. And those are terrible, horrible, horrible histories that we all, as a human rights community, fully reject. But we've not looked at the subtle ways that history is continuing to influence our health systems. And so, as an example, we see that even today, midwives are not empowered in the workplace. And midwives who are, by the way, trained to medical standards, they have, extremely high pay gaps. Even when we correct for occupational segregation, female health workers have some of the biggest pay gaps that we see across industries. And we know that there's a massive shortage of trained, skilled midwives. And that if we corrected that shortage, we would be able to avert something like 30-40% of all maternal deaths, 30-40% of stillbirths and neonatal deaths. But we're not doing that. And one of the reasons that shortage persists is because midwives say they face discrimination in the workplace, including sexual harassment. So there are things that we need to look at and that we need to evaluate, not just because a bad thing happened a long time ago, but because we continue to see the impact of that bad thing today.
Okay, I always love to wrap up by focusing on actions the audience can take. So what can the audience do? I mean, this all seems so big and complicated, but I'm sure there are actions or ways that they can get involved.
I think, going back to our discussion on misinformation and how misinformation can include the absence of correct information, I think it would be really great for people to just get really involved and learn everything that they can about how sex ed is being taught in their communities, finding out, who's designing those curricula? Are they inclusive, as we had said? Not saying to, go in and change things. That's not the point, but making sure that they're both medically accurate and reflective of the needs of the community, that young people have a voice in the development of those lessons, that they're not being shunted aside, that marginalized communities have access to sexuality education. That's just a very concrete way that we can look into what's happening in our own communities. And you don't have to be an expert, but there's a lot of really great information that's out there, and it would be great to make sure that information is penetrating into our own communities and spaces.
Yeah. And along that vein, very similar of you don't need to know all the things, but if people can know that you are a trusted person they can come to with questions, and that doesn't mean I need to have all the answers, right? But I know where I can point somebody and be like, hey, you have a question about this? Advocates for Youth has a really great youth stuff that you can put your young person on and let them go look at their Amaze program, and they have Amaze Junior, and this is where you can send your young people to get the right resources. So I don't need to have the answers, but I maybe know helpful resources I can point people to make sure that they are getting the correct information instead of just the crapshoot that is Googling.
And recognizing that, so much of the information that we have right now is based on only a subset of people. There's so many people who have not been reached by data collection systems. We're still not studying, the female body. Women are not included in clinical trials. There's so many people who have not been included in this, and just taking a beat and saying, where did this information come from? And are there people being excluded? And maybe finding ways to reach out to those voices.
Well, Rebecca, thank you so much for being here. It was such a lovely conversation about a great report.
Thank you so much. This has been a real pleasure.
Okay, y'all, I hope you enjoyed my conversation with Rebecca. It was really wonderful to get to talk to her about, some good news, some of the making sure we celebrate the progress that has been made the last 30 years, but also making sure that we are addressing all those inequities that still exist. And with that, I will see everybody next week. If you have any questions, comments, or topics you would like us to cover, always feel free to shoot me an email. You can reach me at Jennie, Jennie, at reprosfightback.com, or you can find us on social media. We're at Repros Fight Back on Facebook and Twitter, or Repros FB on Instagram. If you love our podcast and want to make sure more people find it, take the time to rate and review us on your favorite podcast platform. Or if you want to make sure to support the podcast, you can also donate on our website at reprosfightback.com. Thanks all.